So now I'll be completing and showing the competencies in medication administration. So before wearing gloves, of course, you need to wash your hands and also always wear gloves to avoid contamination. First, we will dispense 2 pills from a container into the medication cup. So let's open the lid or the cap and drop 2 pills on it. So we should drop 2 pills in the cup or the lid first before we will transfer to the cup to avoid contamination. So now, as you can see, there are 2 pills in it, and we will transfer it to the medication cup. So now, we have 2 pills in a medication cup. Next, we will split 1 pill into equal halves. So I have here a splitter. So make sure do not touch this part because it is very sharp and for us to avoid accidents. So we will open 1 pill here in the medication package. So I'm opening it. So the medication has the individual's name, what time, and the milligrams of the medication. So I'm opening it and putting it on the center. So make sure it is in the center, and then you close it. And as you can see, it is equal. So the first half is this one, and the second half is here. It is important if ever the medication has a dosage of 10 milligrams and you need to give 15 milligrams to an individual. So you have to give the 10 milligrams and split into halves the other pill to obtain another 5 milligrams to get an exact 15 milligrams dosage. Third, how to crush a pill. So 1 pill will be placed into a clean medication crusher. So this is a medication crusher. You must check if it's dry, not damp, nor dirty to avoid contamination or wasted medication. So as I'm placing a pill into the crusher, I'm making sure it's placed in the center also. And to have an even powdery result. So here it goes. Closing it and then twisting it. Well, you have to do it again for a couple of times to be sure that you get the powdery result. So sometimes in a physician's order or note that a crushed pill is placed or been together with an applesauce or yogurt. So you can put it, as you can see here, I have a powdery result for a crushed pill. So in putting it or mixing it with a yogurt, you don't have to mix it well with a yogurt. You can put it above and then take a spoonful and give it to the individual. Do not mix it because we're not sure if the client will take or eat all of the yogurt, and we're not sure if they will take it all or take the medication. So that's a crushed piece. Also, when cleaning this crush peeler, you have to air dry it after, so that when we'll use it for the next client or next time, it is already well cleaned. Then I'll pour a liquid medication from a bottle into medication cup, total of 20 cc. When pouring, you should place the medication cup on a flat surface to have an even measurement, and make sure it's in your eye level. So you can put it in a steel cabinet if there's any, or bend it on a table. So now I'll show you. So here I'm pouring from a medication bottle to the medication cup. So there you go, 20 cc. So as a result, here's the 20 cc. I'm not sure if you can see it well. So that's why I place it on a flat surface, a table, to have an accurate measurement. Now we'll use a syringe to draw up to 2 cc medication from the medication cup that we used earlier. And you must see to it that you didn't produce any bubbles on the syringe. So I'll take it out first to avoid bubbles. So now I'll show you how to draw a 2 cc. Sometimes, to be accurate, you have to take it from the bottle also, so that you won't have any wastage medication on cap, because sometimes it won't be accurate, like 2 cc. So now I'll draw a 2 cc of medication liquid. Medication liquid from a cup. So there it goes. So as you can see, here's a 2 cc of medication liquid. If ever there's a bubbles, so you can just draw it for a bit, and there it goes. And now we will dispense 1 dose of medication from blister pack into a medication cup. So this is what blister packs look like. So make sure the right blister packs have the right information about the individual. And now we will open and put it on a medication cup right away for it to be sterile and to avoid contamination. So check also what time the medication should be given and all information of the individual. So now, some blister packs have like you will just push it right away, but also you can open it like what I did and then put it right away on the medication cup. So now we have 1 pill from the blister packs. And lastly, we will dispense 1 dose of medication from a Bacmed multi-dose packet into medication cup. Usually the pharmacy is using this kind of medication package already. It is much more convenient as well, since the time, dosage, and all information of the drug is already written. So make sure the right time, right patient, right dosage is provided. So now I'm opening it, and then I'll draw or dispense one pill into the medication cup. So here it goes, and thank you for listening, and always remember to ask when in doubt.